Welcome back. In this video, we will continue our video course on medical terminology. In this video, we'll go over chapter number 8, the cardiovascular system. First, the learning objectives for this chapter. Define and spell the word parts used to create terms for the cardiovascular system. Break down and define common medical terms used for symptoms, diseases, disorders, procedures, treatments, and devices associated with the cardiovascular system. Build medical terms from the word parts associated with the system. And lastly, pronounce and spell common medical terms associated with the cardiovascular system. First, we'll go over some basic word parts that you'll see over and over again for the system. The first one, angio, is a reference to a blood vessel. Aorto is a reference to the aorta, which is the largest artery in the body. Artero or arterio is a reference to an artery in general. Atrio is a reference to the atrium, which are the receiving chambers of the heart. And then cardio is a reference to the heart in general. The next term, corono, is a reference to a crown or a circle. And for this system, the coronary arteries are arteries that circle around the heart. So that's why they're called coronary arteries. Myo or myoso is a reference to muscle. Pectoro is a reference to the chest, such as your pectoral muscles or the main muscles of the chest. Valvulo is a reference to a valve. And vaso is a reference to a vessel or a duct. Vasculo, a reference to a blood vessel. Veno is a reference to a vein, and ventriculo is a reference to the ventricles of the heart, the actual pumping chambers of the heart. Alright, now we'll go over some background information about the system. Of course, the system is going to be responsible for circulating a continuous supply of oxygen and other nutrients to all the cells of the body. Not only delivering oxygen and nutrients to these cells, but also picking up carbon dioxide and other waste products that your cells produce to take it away from the cells. Now, these materials are delivered within the blood through a series of blood vessels, and they're pushed along mainly by the pumping action of the heart muscle. All right, here's a very generic overview of the cardiovascular system. Whenever you see an image like this, the parts that are in a blue or light blue indicate that has blood without oxygen, and the parts that are in red, like here, indicate that blood does have oxygen. So you have blood being pumped from the right side of the heart, going to the lungs to pick up oxygen, and when it comes back, it'll be pumped through the aorta to the rest of the body. All right, now we'll talk about some anatomy and physiology of the system. First off, the functions. The heart will be the pumping organ of the system. In order for blood to get from, say, where your heart is to the top of your head or the bottom of your feet, it must be pumped with a lot of force to make it all that way. Of course, blood vessels are to carry the blood through various parts of the body and then back to the heart. And also the exchange of materials. The exchange of materials in the blood system happens within capillaries. And capillaries are the vessels that join the smallest artery to the smallest vein. That's where the real work gets done when you're talking about exchange of materials. All right, here's an image of the internal anatomy of the heart, the various chambers and various valves that you can see. The chambers that are on top are the atrium, or atria for plural, right atrium, left ventricle, left ventricle. And on here, because it's cut open and you can see internally, you can see these valves here, the tricuspid valve and the mitral valve, and these very strong cords here would enable the valves to open and close at the same time. Of course, after blood is pumped through the main chamber here, the left ventricle, it gets pumped through the aorta, which is this large vessel here, and onto the rest of the body. All right, now we'll talk about some pathophysiology. Diseases of the cardiovascular system can greatly reduce or even stop blood flow to parts of the body, and that happens, you can get cell death pretty quickly. If cells don't get oxygen, they can't function, so they will start to die. When you have a large number of cells die, then you have tissues dying, and then organs dying, and then you dying. So diseases of the system can become very serious very quickly. Some terms associated with pathophysiology here. Cardiology is the study of the heart in general. Someone who practices in this field of medicine will be a cardiologist. And when you're talking about the system, is the cardiovascular system. It's not just the heart itself. It's the heart plus all the blood vessels together. So that's why it's the cardiovascular system. Cardio is a reference to the heart, and vascular is a reference to the blood vessels, all the arteries, all the veins, all the capillaries. So that term references everything all together. So it's not just a study of the heart. All right, now we'll go over some signs and symptoms, some word parts that you'll see quite often. One we've seen a lot in this video series, A, will be without or lacking. Brady means slow. So if you have a slow heart rate, you are bradycardic. Dys means painful or difficult or abnormal. Tachy means fast. So brady is the opposite of tachy. Someone who has a slow heart rate would be bradycardic. Someone who has a fast heart rate would be tachycardic. Now we'll talk about some common combining forms. Angio refers to a blood vessel. Cardio, the heart. Cyano is refers to blue, because remember cyan is a shade of blue. When tissue is lacking oxygen, it will turn bluish or purplish in color. So that person would be described as being cyanotic. Pectoro is reference to the chest. Rhythmo is reference to the rhythm, in particular the rhythm of the heartbeat. And last term on here, steno, is a reference to being narrowed or being constricted, such as a blood vessel. Some common suffixes you'll see. For this system, is usually a reference to a plural form of a Latin word. For example, when talking about one of the upper chambers of the heart, that would be an atrium. If you're talking about both of them together, that would be atria. So that would indicate a plural form of a Latin term. The algia is a reference to pain. And the next term, dynia, is also a reference to pain. The suffix genic is a reference to being produced by or being produced in. And the suffix ia is a reference to a condition. The osis, this is an abnormal condition. The suffix plegia is a reference to a paralysis. The ending cis is the state of or a condition. And spasm is a reference to a sudden contraction of a muscle. Alright, now we'll go over some signs and symptoms of the system. The first one, angina pectoris. This means having severe pain within the chest. Angina is a reference to pain. Pectoro is a reference to the chest. This is a very strong indicator of poor blood flow within the heart. Angiospasm, break that term down. Angio means blood vessel. Of course, spasm means a sudden involuntary muscle contraction. So this literally means a muscle contraction in a blood vessel. And the last term here, angiostenosis. This is the constriction or the narrowing of a blood vessel in general. Alright, the next term, arrhythmia. This is a reference to an abnormal or irregular rhythm of the heart. And the heartbeat should be a very coordinated manner. And when things get out of sync, that can cause serious problems to the patient. This covers a very wide range of conditions. Another term for this would be dysrhythmia. That also means an abnormality within the heart rhythm. So those terms are synonyms for one another. Bradycardia. Remember, brady means slow, so this would be a slow heart rate. Next term, cardiodynia. This is a reference to having pain within the heart region. And last term here, cardiogenic. This is something that is originating from the heart, or something that is caused by a cardiac condition. Cyanosis. This is having a bluish appearance due to the lack of blood flow, or the lack of oxygen within the blood. Palpitation. This is a reference to a very strong, very rapid, or an irregular heart rate, usually brought on by illness or by exercise. Tachycardia is having a fast heart rate. And last term here, syncope. This is the temporary loss of consciousness caused by a sudden fall in blood pressure. So basically, when someone faints, they are experiencing syncope. They are losing consciousness and aren't aware of what's going on around them. Now we'll talk about some diseases and disorders and some word parts that go along with them. Endo, of course, means inside. Epi would mean above. Hyper would mean in excess of. Hypo would mean lower than. Peri means surrounding. And poly means many or more than one. Some common combining forms. Many of these we've seen already. Angio is reference to a blood vessel. Aorto is reference to the aorta. Arterio is reference to an artery. Athero is reference to a plaque, which is a fatty material that you'll find in some blood vessels. And atrio is reference to the atria, the receiving chambers or the upper chambers of the heart. Cardio is reference to the heart. Corono is reference to either a crown or circling around. Hemo is reference to the blood. Ish or isho is a reference to holding back. Then myo is a reference to muscle. Phleb or phlebo is a reference to vein. So whenever you have your blood drawn, you usually see a phlebotomist. Sclere or sclero is a reference to hardening. You can also reference the sclera, which is a part of the eye. But for this system, it will reference the hardening of arteries usually. See, next term, sept or septo is a reference to a partition or a dividing structure. In your heart, you have a septum that divides the right and left ventricles, a septum that divides the right and left atria. So it is a divider, a partition. Steno, of course, means constricted or narrowed. Tympano is a reference to plug, to plug something. Tenso is a reference to being stretched or being strained. Thrombo is a reference to a blood clot. Valvulo is a reference to a valve. Varico is a reference to varicose veins. And ventriculo is a reference to the ventricles, the pumping chambers of the heart. All right, now we'll cover some common suffixes. The ending AC means pertaining to. All right, 3 of these terms reference the same definition. So the suffix AC, AL, and AR all mean pertaining to. And the second term here, the suffix ADE, is a reference to an action. Emia is a reference to of the blood. The suffix IC, means pertaining to. The suffix ION is a reference to a process. And the suffix itis means the inflammation of. The suffix megaly means an abnormal increase in size. Oma is a reference to a tumor. Osis is a reference to an abnormal condition. And then pathy is a reference to disease. Okay, now we'll talk about some specific diseases and disorders of the cardiovascular system. The first one listed, aneurysm. This is a weakening of an artery wall which causes it to become quite large and eventually will rupture. Think of a balloon being overfilled with water. So when that artery will rupture, you're going to have a loss of a large amount of blood very quickly. Angiocarditis. This is an inflammation of the heart and blood vessels. The angioma. This is a tumor that's made up of new lymphatic vessels or new blood vessels. An example of angioma is a hemangioma. And we're going to break that word down. Of course, hemo means blood. Angio means blood vessel. And oma means tumor. This is a benign tumor of blood vessels. On this image, we have an example of an aneurysm. If you look at this area right here, this is a part of the aorta, but this area is enlarged, much larger than it should be. This bulge here is the actual aneurysm of the aorta. And if this vessel were to rupture, because it is the largest artery of the body, this person would be in very immediate danger. So our next term, AI, aortic insufficiency. The other term for this is aortic regurgitation. This is where you have a leaking within the aortic valve, which causes the blood to go backwards, to go back into the left ventricle. Anytime you see the word regurgitation, that means material is moving backwards. So the blood is not being pumped through the aortic valve sufficiently. That's why it's called aortic insufficiency. Aortic stenosis. This is a constriction or a narrowing of the aortic valve. Aortitis. This is an inflammation of the aorta itself, the actual wall of the aorta. It's not that very common at all, but it is a life-threatening situation. The last term here, arteriopathy. This is a general term that means a disease of the arteries. See the first term on here, arteriosclerosis. This is a narrowing or constricting of arteries in general. So this term, arteriosclerosis, is a very broad term. And if a patient suffers from arteriosclerosis, they can have any number of what will be classified as an arteriosclerotic heart disease. This would include any acute condition or even a chronic condition. These are all a result of having inadequate oxygenated blood flow to the heart. And an example of that would be atherosclerosis. People get these two terms confused quite often because they sound so similar. Arteriosclerosis and atherosclerosis. And they are not the same thing. There is a difference. Atherosclerosis is the narrowing of a vessel because of the deposits of plaques or fatty material. So atherosclerosis is an example of arteriosclerosis. Here's an example of atherosclerosis. We're zooming in on these coronary vessels here, and this yellowish material here. This would be the plaque, the fatty material that's depositing. As this vessel gets more and more constricted, the less blood flow can travel through that vessel effectively. So the heart has to work harder to get the same amount of blood volume through this area because it's being blocked. See our next term, ASD, atrial septal defect. This is an abnormality or a defect within the septum between the atria. There's a septum or a partition between the two atria, and there's a septum between the two ventricles. So if there's a defect or a abnormality in that septal wall, that's classified as an ASD. And this is a good example of a congenital heart disease. This is something that you are born with. Atriomegaly. This is an abnormal enlargement of the atria. Anytime you impact the size of an organ, you're going to impact its function. So by increasing the size of the atrium, you're going to impact how efficiently it works to move blood down to the ventricles. And our last term here, atrioventricular block or AV block. This is a reference to the conduction system of the heart, where the conduction is blocked between the atria and the ventricle. In a normal heartbeat, everything has to happen in a sequential order. Everything has to be very coordinated for this to work. There are a lot of things that are going on. Some chambers are contracting, while some other chambers are relaxing and filling the blood. Some valves have to be open, while other valves have to be closed. Everything has to work in an orderly manner. If things get thrown off, then it's going to impact the overall effectiveness of the heart. So if you're blocking the signal that tells the heart muscle when to contract and how hard, you're going to impact blood flow to the lungs and also from the ventricles out to the body. So our next term, cardiac arrest. Now people confuse this with heart attack, and they use those terms interchangeably, and they don't mean the same thing. Anytime you see the word arrest, that means a stoppage. So a cardiac arrest is a sudden stoppage of the function of the heart. Sometimes it's temporary, sometimes it's not. But cardiac arrest is not the same thing as a heart attack. This is also known as SCA, sudden cardiac arrest. Our next term, cardiac tamponade. This is a condition where you have a buildup of fluid between the heart muscle itself and the sac that it sits in, the pericardium, and that buildup of fluid is causing compression on the heart muscle. And this buildup of pressure will impact how well the ventricles contract. They can't relax fully. They can't fill up with enough blood that they normally would. So because they can't fill up with enough blood, they can't pump enough blood out. So the heart has to work harder. Last term here, cardiomegaly. This is an abnormal enlargement of the heart in general. Cardiomyopathy. This is a chronic disease of the heart muscle. Cardiovalvulitis. This is inflammation of the heart valves. There are 4 valves that are found in the heart. And our last term here, coarctation of the aorta. This is a narrowing of the aorta. See our next term, CFH, congestive heart failure. This is the inability of the heart to keep up with the demands that your body puts on it. And depending on what size of the heart is impacted, will lead to different signs and different symptoms. This could be an issue of the left-hand side of the heart or on the right-hand side of the heart. Left ventricular failure, as the name kind of implies, it's the failure of the left ventricle to be able to contract efficiently enough. It's also known as left-sided heart failure. And when this happens, the blood has to go somewhere. Well, the circulatory system is one continuous circuit. If the blood can't be pumped forward, it's going to back up and has to go somewhere else. So when the left-hand side of your heart fails like this, the blood gets backed up into the lungs. So you get a swelling or an edema of the lungs. So our next condition, cor pulmonale. This is an abnormal enlargement of the right-hand side of the heart due to a disease of the pulmonary blood vessels. This is also known as right-sided heart failure or right ventricular failure. Because the right side of the heart is working harder, it actually increases in size. But like we saw with left-handed sided failure, the blood has to go somewhere. If it can't be pumped from the heart to the lungs, the blood will actually pool in the extremities or in some of these softer organs. So in the liver, in the spleen. Your next term, coronary artery disease or CAD, where you have a buildup of plaques in the coronary arteries. The coronary arteries are the arteries that supply the heart with its own blood supply. Remember, the heart is an organ, and all organs need a supply of blood to be able to function. So the coronaries are the heart's own blood vessels. Coronary occlusion. This is where you have an obstruction of a coronary vessel, either a partial blockage or a complete blockage. So an occlusion is another term for an obstruction or a blockage in a coronary vessel. This is what will often lead to having a heart attack. Embolism. This is where you have a blood clot or a thrombus that breaks off from its original site and will start to travel throughout the body. If it enters the lungs, it's called a pulmonary embolism. The blood is the last thing that you want solid materials just floating around in, because the blood will eventually get to all parts of the body. It will travel to your heart, to your brain, to your lungs. So these can only be not only painful, but it can become fatal if the embolism is large enough. And our last term here, endocarditis, is the inflammation of the endocardium, which is the innermost lining of the heart. All right, in this image, we have an example of endocarditis. You have the internal anatomy of a heart here. If you look close, these masses here, these yellowish looking masses, those are called vegetations. These are caused by a bacterial infection. So endocarditis is a bacterial infection. of the innermost lining of the heart. So whenever you interfere with the structure of the valves, you're going to interfere with how well they function. So your next term, fibrillation. This is a general term that just means an uncoordinated, having very rapid and irregular contractions. So depending on what part of the heart is affecting will give you a more specific name. AFib, or atrial fibrillation, is fibrillation but within the atrium or within atria. And VFib, or ventricular fibrillation, is that uncoordinated, rapid, irregular contractions in the ventricles. And heart block, this is a reference to how quickly the heart contracts. And this is an abnormal rhythm where the heart actually contracts too slowly. The electrical impulse that tells the heart, or tells the different parts of the heart when to contract, is slowed down or blocked. So the signal doesn't get to its intended target like it should. And there are different degrees of heart blockage depending on how impaired the signal is. The heart murmur, this is actually a reference to the sound that your blood makes as it goes through the valves and travels through your heart. It's made by turbulent blood. So normally blood should be all moving forward, but sometimes the valves don't work as properly as they should, so they don't close like they should. So sometimes blood will go backwards, and this backward movement of the blood causes a turbulence in blood, which causes the blood to sound like it's swirling or whooshing, and you can hear it with a stethoscope. And murmurs are fairly common. They usually aren't a big deal, but it's something that should be monitored, because if they do get worse, that would indicate more serious of a structural issue with the valves. And something that would lead to the development of a heart murmur is something called MVP, mitral valve prolapse. The mitral valve is a valve found between the left atrium and the left ventricle, so on the left-hand side of the heart. And what happens here is one of the areas of the valve, one of the leaflets, or one of the flaps in the valve, has become thickened due to this disease, and it has now become displaced. It is prolapsing. So instead of both of these flaps in the mitral valve opening and closing at the same time like they normally should, one side is thicker than the other, so they can't open or close in a coordinated way. So this unequal motion causes blood to go backwards. So instead of going from the left atrium to the left ventricle and then out through the aorta, it will start to build up in the left atrium and not go forward. See, the last term here, hemorrhoids. This is obviously a reference to the rectum area. And a hemorrhoid is a swollen vein or a swollen group of veins that are found near the anus, or near the rectum. Hypertension. This is having high blood pressure. This can be caused by any number of things. When you have high blood pressure, your heart will be working harder than it normally should to accomplish the same amount of work. Now, there are different types of hypertension. The first one is listed, essential hypertension. It's also known as primary hypertension. And it's called primary hypertension because there's no identifiable cause for the condition. And compare that to secondary hypertension. Sometimes this is called inessential hypertension. This is caused by an identifiable condition, or by identifiable underlying cause. So you develop secondary hypertension because of another disease or another illness. And the opposite of those, hypotension. This is having low blood pressure, or abnormally low blood pressure. And your blood pressure should be within a certain range to be considered healthy, but if it's too low, that means your heart isn't pumping enough blood. And if it gets really low, then you won't be able to remain conscious. So our next term, ischemia. This is an inadequate blood supply to a part of the body, in particular the heart muscles. So there's a holding back or a withholding of blood to tissue. Then when this happens, tissue will start to die. That can lead to an MI, myocardial infarction. This is the technical term for a heart attack. And what this term really means is, the first part is reference to the heart muscle. Myo means muscle, cardial is reference to the heart. So the actual heart muscle itself. And the second part of this term, infarction, means an obstruction of blood supply to tissue, which leads to that tissue dying. That's what's going on with a heart attack. There's an obstruction in the coronary arteries somewhere, so that's the infarction, and that blockage is causing tissue beyond that point to die. So that's a myocardial infarction, or a heart attack. So your next term, myocarditis, is inflammation of the heart muscle itself. Your next term, PDA, patent ductus arteriosus. This is a reference to one of the features that's found in a developing fetus that should normally go away once the baby is born, but sometimes it doesn't. There's a structure that a fetus has due to the different blood circulation called the ductus arteriosus. Now, if the baby is born and this structure doesn't heal properly, it's called a patent ductus arteriosus. And our last term here, pericarditis, is an inflammation of the pericardium, which is the outermost lining of the heart. On this image, we have an example of an MI, myocardial infarction. Zoom in on this area here. Because there's an obstruction in the left ventricle wall, this area around it can't get enough blood that it should, so that's why it looks blackened. This tissue is starting to die. And once you have dead heart tissue, it can't recover. Once it's gone, it's gone. So this is what a heart attack will look like. Our next term, phlebitis. It's an inflammation of a wall of a vein. An example of this would be thrombophlebitis. This is where you have an inflammation of the wall of a vein because of a thrombus or a clot within that vein. Something that's common with women who are pregnant. Polyarteritis. This is a reference to having inflammation of multiple arteries in different locations. Alright, our next term, septicemia, is the other word for blood poisoning. It's either caused by bacteria directly or the toxins that they produce. Next one, tetralogy of Fallot. It's a fairly complex but common heart defect. It involves 4 issues with the heart. That's why it's tetra. Tetra is reference to 4. But there are 4 main issues going on with the heart at different areas of the heart and the vessels. But that is a congenital heart defect. Thrombosis. We're going to break this word down. Thrombo is reference to a blood clot. And osis is the condition of. This means the condition of having localized blood clotting. Alright, our next term, varicosis. This is a reference to varicose veins. And in that condition, veins will be abnormally enlarged or they'll become twisted. And when that happens, the veins will get closer to the surface of the skin, so you have the appearance of light blue vessels right near the surface of the skin. And these can happen in any part of the body, but they are more commonly found in the legs. And our second term here, VSD, ventricular septal defect. This works the same way as our atrial septal defect we talked about earlier does. There is a partition, a dividing wall, or a septum between the 2 ventricles, right ventricle, left ventricle. If there's a abnormality or a hole or some defect in that partition, that's classified as a ventricular septal defect, or a defect within the septum of the ventricles. Alright, in this image, we have an example of varicose veins. What really happens is many veins will have valves in them to prevent blood from flowing backwards. If these valves don't work properly, then the veins will become twisted or dilated, and so you'll get blood pooling in these enlarged veins near the surface of the skin. That's why you see these varicose or these spider veins. Here's a real example of how some varicose veins will look. And a spider vein is another term for a small varicose vein. Alright, now we'll talk about some treatments, procedures, and devices, and some of their word parts. Many of these we've seen multiple times already. Let's see, the prefix endo means inside. Now the endocardium will be the innermost lining of the heart. Some combining forms. Angio is a reference to a vessel. Aorto is a reference to the aorta. And arterio, artero is a reference to an artery. Some other combining forms. Cardio is a reference to the heart. Chrono, for this body system, is a reference to the coronary arteries or the coronary vessels. Echo is a reference to reflected sound. Electro is a reference to electricity. Embolo is a reference to an embolus, which is a traveling blood clot. A blood clot that is broken free of its original site and is now traveling throughout the body in the blood. And our last term here, mano, is a reference to pressure. Phleb or phlebo is a reference to veins. Pulmono is a reference to the lungs. Sono is a reference to sound. Sphygmo means pulse. Thrombo is a reference to a thrombus or a blood clot. Valvulo is a reference to a valve. Right, now we'll talk about some common suffixes. The first 2 suffixes have the same definition, AC and ARY. They both mean pertaining to. Ectomy, the surgical removal of. And the last 2 are related, but they are 2 separate items. The first one on there, gram, is a reference to a record or the results of a test. Which would be related to that would be the suffix of graphy, which means the process of recording. So be careful not to confuse the suffixes gram and graph and graphy. All interrelated, but all 3 mean 3 distinctly different things. The suffix lytic means to separate or reduce or break down or destroy. Meter means to measure. Metry is the process of measuring. Plasty surgical repair of, and araphy is reference to a suture. So our next one, scopy is a visual examination. Stomy is a new opening that's formed. And the last term on this slide, tomy, means the process of cutting. All right, now we'll talk about some specific treatments, procedures, and devices of the cardiovascular system. So our first term here, angiography. This is an exam of blood vessels or lymphatic vessels that are performed by an X-ray after you introduce a type of injectable dye into them. So it is the process is the actual examination of these vessels. And the results that you would get from that exam would be an angiogram. And when you're looking at the vessels of the heart in particular, that would be a coronary angiography or cardiac angiography. So your next term, angioplasty. This is the surgical repair or the unblocking of a blood vessel, usually a coronary blood vessel. There are two common ways that this is done. The first is a balloon angioplasty, where a deflated balloon is inserted into the artery itself. The balloon is inflated, and by doing so, it will crush or blast away the obstruction or the plaque that's blocking the coronary artery. Another way you could do this would be using a laser, so laser angioplasty. So instead of a balloon being on the end of the tubing that enters the coronary vessels, you have a very small laser that is equipped on the end of the tube, and that laser is used to blast away the obstruction or blast away the plaque within the coronary vessels. But in either case, the point is to clear up a blockage in a coronary vessel. So going back to our main term here, angioplasty, if you were to break that term down, of course, angio means a blood vessel, and plasty, the surgical repair. So the surgical repair of a blood vessel, either by using balloons or lasers. All right, here's an illustration of how angioplasty would work. In this example, we have a balloon angioplasty. You have a catheter that's fed into the patient's femoral artery, usually, because it's one of the larger arteries in the body. On the tip of that catheter is a small balloon. So in this example, this area here is obstructed by these yellowish colored plaques. So you would insert the catheter up to the point where the obstruction is. The balloon would be inflated, and as that balloon gets inflated, it will basically crush or squish the plaques against the wall of the arteries. Sometimes that process is over. Sometimes a stent is left in its place to help hold open the blood vessel. Your next term, angioscopy, is the visualization of the interior of blood vessels. The tool you would use to view this would be an angioscope, because a scope is the actual instrument of viewing. Angiostomy, this is establishing a opening into a blood vessel. And our last term here, angiotomy, is an excision of a section of a blood vessel. That's actually cutting into and removing of a part of a lymphatic vessel or a blood vessel. So next term, aortography, is a visualization of the aorta and its various branches. It's done so by injecting a dye into the vessels, and the results you would get from that testing process would be an aortogram. And closely related to that, arteriography, the visualization of the inside of an artery. So it would be the overall process, and the results that you would get from that test would be an arteriogram. So same basic concept as an aortograph, aortogram, arteriograph, arteriogram, or angiogram. One is a term referencing the overall process of viewing inside of that vessel, and the other is the results of those tests. So next term, arteriotomy, is a reference to an opening or cutting of an arterial wall, and that term will be related to the next two, arterioplasty, which being the surgical repair of an artery. In order to surgically repair a vessel like that, you would need to cut into it. So those terms would be related. Those two terms will lead you to the third term here, arteriography, which would be a suture within an artery. So your next term, auscultation. This is the action of listening to sounds of the heart or the lungs or other organs by using a stethoscope. And of course, a stethoscope used to listen to internal organs, like the heart in particular, where you have the resonator. It looks like a small disc that's placed above the organ, and then the two earbuds that go inside the ears. So your next term, cardiac catheterization. Catheterization means the insertion of a catheter, which is a long, thin tube, into any number of organs. So when you're talking about cardiac catheterization, you're talking about inserting a long tube inside the heart or the heart vessels to either diagnose or to treat medical conditions. Our next term here, cardiac pacemaker. This is an artificial device that's implanted into some patients whose natural pacemaker doesn't work well enough on their own. Every heart has a natural pacemaker that helps to stimulate the heartbeat. When that doesn't work properly, someone will need an artificial machine to take over that role. That's what a cardiac pacemaker does. In this illustration, we have an example of cardiac catheterization. You have a long, thin tube called a catheter inserted into a blood vessel. It could be in the leg or in the arm. In this example, it's going into the brachial artery of the arm. So that tubing will go in here. It will work its way all the way into the heart. And again, this is used to diagnose or to treat cardiac conditions. In this image, we have an example of a pacemaker implanted just below the skin, usually just under the collarbone, either on the left-hand side or the right-hand side. And it will connect to the heart through a series of leads, depending on what that patient's particular needs are. So our next term, CPR, cardiopulmonary resuscitation. This is a life-saving procedure that's done to help restore a person's heart rate or breathing. It's a combination of chest compressions and also breathing into the patient's mouth. So our next term, CABG, coronary artery bypass graft. This is a surgical procedure where vessels of the heart, the coronary vessels, if they become too obstructed, sometimes the best way to fix that is to basically divert blood around that blocked area. So you are making a bypass. So a section of healthy blood vessels, usually from the leg, is taken out the patient and then sewn into the heart, and basically redirecting blood to go around the blocked area. So that's why it's called a bypass. You are going around, or you're bypassing the blocked area. And a third term here, a coronary stent. This is a reference to a tube-shaped structure that's inserted into a coronary vessel to help prop it open and help keep it open. And by doing so, you're going to increase the amount of space that the blood can flow through that vessel. This is mainly done to help free up clogged coronary arteries. All right, in this image, we have an example of coronary artery bypass graft, or CABG. All right, on this image, you'll see three separate areas of occlusion, or three separate areas of blockages. You see a blockage here, here, and here, all in the yellow. So if those become too occluded, then the areas beyond those points will start to lose blood flow and then lose oxygen and will start to die. So for this example, you have these sections of veins that were taken, or vessels that were taken from the patient's leg. They're taken out and they are basically grafted onto the coronary vessels. So the areas that are blocked, that are occluded here, here, and here, are basically ignored by the blood flow. Blood flow was now redirected around the occlusions. That's why it's called a coronary artery bypass graft. You're involving arteries from the heart, the coronary artery. You are bypassing some damaged areas, and you are grafting vessels onto the coronary vessels. All right, in this image, we have an example of a coronary stent. This is showing the various steps of inserting one. The first image here, we have the beginning picture of the artery with the plaques that are blocking this vessel. You only have a very narrow amount of space for blood to flow through here. So the catheter will be inserted in this location. And of course, the catheter will have the stent that's collapsed at this point. Once it gets to this area, the balloon will be inflated, basically crushing the plaques on either side. The stent is put in place almost as a internal scaffolding to help prop open the vessel, and then the balloon gets removed. So that stent stays there. So going from here to here is a big difference in how much space you're going to have so blood flow can flow through this vessel. So our next procedure, defibrillation. This is the process of stopping fibrillation within the heart. Fibrillation is the uncontrolled, uncoordinated, rapid heartbeat. And the way you can have defibrillation is by using an AED, an automated external defibrillator. These are the paddles that you see when someone yells clear, and then they hit the buttons and a person's chest kind of jolts up due to the electric shock. That's an AED. And the whole point of this isn't to start the heart. The whole point is to stop the heart so it can stop and then reset itself to go back to a normal heart rhythm. Because you want to get rid of the uncontrolled fibrillation. The only way to control that is to stop it so it can reset by itself. Now, some patients have an internal form of this AED, and it's called an ICD, an implantable cardioverter defibrillator. It's the same process as having the paddle, but this is an internal device. So whenever the heart starts to get out of control, this device will detect that and administer a very violent shock to the heart in order to get it to stop and then restart to go back to normal. But it's the same principle as an AED, it's just implanted inside the patient. In our last term, Doppler sonography. Sometimes this is called a Doppler ultrasound. This is a test that uses sound waves to estimate blood flow through various vessels. A regular ultrasound can produce images, but it can't show the blood flow in the vessels, and a Doppler sonography can. Alright, in this image we have an example of an AED being used. So you have the pedals that are placed at certain parts of the chest. The apex of the heart would be down here, and the sternum would be up here. And by pushing that button, that's when the very powerful charge would be introduced into the pedals, causing the patient's chest to violently thrust upward as the heart gets reset. And in this image we have an example of an ICD. Just like a pacemaker, it's implanted just under the skin, usually right underneath the clavicle or the collarbones. And there are some devices that will function as both an ICD and a pacemaker, depending on that patient's particular needs. Some patients only need one, some patients need both of those. So our next term, echocardiography. This is a testing procedure that uses ultrasound waves to produce a visual image of the heart or any other internal structure. Notice it's used for diagnosing heart issues, mostly structural issues or blood flow issues. It's called cardiac ultrasonography. And the results that this would produce would be an echocardiogram. Our next term, electrocardiography. This is a testing procedure that measures the electrical activity of the heart. And the results that are produced by this exam are called electrocardiogram. Sometimes you'll see this written as ECG or EKG. And for many heart patients, their heart issues only come up or are made much worse during periods of strenuous exercise. So they are usually given a stress test, such as running on a treadmill or riding a stationary exercise bike. So during this type of test, they're given a stress EKG to see how well the heart is performing under physical exercise. So both a regular EKG and a stress EKG are used to evaluate and diagnose any issues with the electrical system of the heart. Here's an example of what an EKG would look like. Various numbers of leads are put on the patient's chest and abdomen. Now, this image we have what a normal EKG would look like, and these peaks and these valleys have very particular names, and they represent very particular things that go on within the heart during a normal cardiac cycle, during a normal heartbeat. So knowing what these peaks and these valleys represent and knowing how it should look is a very good diagnostic tool to be able to tell what is going wrong with that patient. So next term, embolectomy. This is the surgical removal of an embolus, a traveling blood clot. So our next term, endarterectomy. This is a surgical procedure that's used to reduce the risk of stroke in the patient. It's usually done by removing the material on the inside of the vessel in order to correct the stenosis or the narrowing of that vessel. But the whole point is to remove the junk inside that vessel to help reduce the risk of stroke. And our last term here, a Holter monitor. This is a portable device that's worn by a heart patient for a 24-hour period. It's really just a 24-hour EKG. The patient wears it through the normal activities, so there's a full day record of what that patient's heart goes through a regular day in their life, as opposed to a 2-3 minute test laying on a table that a normal EKG would offer. Nitroglycerin is a very common medicine that's used to alleviate chest pain. It can also be used to treat high blood pressure or help control congestive heart failure. Phlebectomy is a procedure that is used to remove varicose veins, the surgical removal of veins. So it's primarily used for varicose veins. Phlebotomy, this is the practice of drawing of blood from patients. So you are producing a surgical opening within a vein in order to withdraw blood. And a person that would perform this procedure would be a phlebotomist. So if we could break down this term here, phlebotomy. Phlebo means vein, and tomy, an incision or to cut, technically cutting into a vein in order to withdraw that blood. And this is how this would look. The person wearing the gloves and performing this procedure would be the phlebotomist. So your next term, a PET scan, positron emission tomography, a very detailed imaging technique that's used to detect various forms of disease and cancers in the body. And it's done so by injecting certain types of radioactive dyes into the patient, and then tracking where those dyes end up. But very detailed, very good imaging technique. Last two terms here are related. The first one, sphygmomanometry. This is the overall process of taking someone's blood pressure. And the device that would be used to do this would be a sphygmomanometer. This is another term for a blood pressure cuff. Remember, if you were to break that term down, sphygmo means pulse, mano means pressure, the meter means to gauge. You are measuring the pressure of the pulse. So it's a blood pressure cuff. So your next term, thrombolytic therapy, also known as thrombolysis. This is a treatment that's used to help dissolve dangerous clots in the blood vessels. The thrombo is always refers to clot. Lysis means to break down or to destroy. Treadmill stress test. I mentioned this earlier with the stress EKG. This is putting a person on a treadmill and hooking them up to an EKG to monitor how their heart functions under stress. And then every 2 minutes or so, the treadmill is increased with speed and increased in incline. So the longer you go, the faster it gets, and then the more incline it gets. And our last term here, valvuloplasty, is the surgical repair of a valve. Now, this can be done by either making small incisions into a valve or inserting of a balloon into the valve. All right, now we'll go over some common abbreviations that you'll find with the cardiovascular system. The first one, AED, automated external defibrillator. AFib, atrial fibrillation, the fibrillation within the atrium or atria of the heart. AI, aortic insufficiency. AS, usually a reference to aortic stenosis. ASD, atrial septal defect. ASHD, atriosclerotic heart disease. And AV, atrioventricular. CABG, coronary artery bypass graft. CAD, coronary artery disease. CFH, congestive heart failure. CP, cardiopulmonary. CPR, cardiopulmonary resuscitation. EKG or ECG, they both reference the same thing. Electrocardiogram. ICD, implantable cardioverter defibrillator. LA, left atrium. LV, left ventricle. MI, myocardial infarction, another term for heart attack. MVP, mitral valve prolapse. And PET, positron emission tomography. RA, right atrium. RV, right ventricle. SCA, sudden cardiac arrest. VSD, ventricular septal defect. All right, we'll end our chapter on the cardiovascular system with our combining form quiz. Terms on the left, cardio, steno, ischo, veno, and vaso. They'll match up with either vein, blood vessel, heart, hold back, or narrow. The first one, cardio, goes to heart. Steno goes to narrow. Ischo goes to hold back. Veno goes to vein. And vaso, blood vessel. And here are all 5 of the terms with their correctly matched definition. And that brings us to the end of this chapter on the cardiovascular system. We will continue our video series on medical terminology with our next video on chapter number 9.